Okay, so what about severe cell injuries? Well, this leads to cell death. And when you have cell death, it's irreversible. You can't wake it up. All right? It's dead, it's dead. Okay? There's no Lazarus going on over here. It's dead. It's black. Okay? So when you have cell death, we call it necrosis. Now, this is one of the things that I did change from my last time I taught this, and I made it easier for you guys. There's 4 types of necrosis. You don't have to worry about what they are and how they're being formed and all that stuff. I made it easier. Just know there's 4 types and call it a day. I want you to know what necrosis is, which we'll talk about, and I want you to know what gangrene is. Gangrene and necrosis are the same thing. The only thing is gangrene is a more advanced form of necrosis. You should know that. And there's 3 different types of gangrene. I do want you to know that because as a nurse or a medical professional, you need to know the differences between there because that's going to expedite immediate treatment or not. Okay, I'll show you what those are in a moment. But you don't have to worry about the 4 different types of necrosis. All right, made it a little bit easier for you. Apoptosis is a fancy word for cell suicide. It comes to the point where a cell divides and divides and divides and says, well, we already did 100. That's what we were told to do. That's all we can do. We're not going to do it anymore, so the cell just dies. Okay? It's pre-programmed. It's supposed to do that. Another thing about apoptosis, cancer, one of the reasons that cancer occurs, not all the time, but this is one, if this cell is supposed to go through apoptosis, the cancer says to that cell, don't have to do that. I'm telling you, it's okay to continue to grow, to divide. So that is one way that cancer does happen. We'll talk about that when we get into cancer. Okay? All right, so if we have prolonged ischemia, remember ischemia is a decrease of blood flow to an area. So if you have a prolonged type of ischemia, you're definitely going to bring less oxygen to that place. That area that place is supposed to get all that oxygen is going to die. Okay? So basically, if we have an area necrosis in a particular organ, we sometimes refer to it as an infarction. If it happens in a muscular, the cardiac muscle, a big area over there, we call it a myocardial infarction. Heart attack, right? Okay. Different tolerances happen in different organs. You don't have to know all of them, but you should know that to the brain can survive. And you're going to see necrosis happening in the brain after 6 minutes of no oxygen. In the heart, it's 20 minutes. And skeletal muscle, well, you can have hours. So we could actually put a tourniquet on someone for, let's say, 2 hours. It should still be fine, and you're not going to kill that tissue. Does that make sense? I'm going to go around testing that on people, but you know what I'm saying, all right? It's just there's differences there, okay? So if the cell injury is due to some sort of bacterial infection, then what's going to happen is the white blood cells are going to release enzymes that dissolve the tissues. And when this does, the white blood cells are going to destroy that bacteria or whatever's happening there, and a mixture of bacteria, white blood cells, and all this debris of all the tissues, of all the garbage that's happening around there, we call that pus. All right, and I think all of you know what pus is, right? If there is, if there's a lot, sometimes we refer to pus as a purulent exudate. Exudate is a fancy word for substances that leave the cell, that exit the cell. So when you have all this, we call it a purulent. Purulent means pus-like. And if you have a big area of this, the size of a marble or a golf ball, then we refer to this big pus-like area that is walled off from the outside, from the other tissues. We call that an abscess. Okay? So a pimple really is a very small abscess where there's pus there, right? You've all done that. I'm not going to show you, but you hold, you know, it's filled with pus, right? So that's a very small abscess. I've seen abscesses the size of footballs, okay? But I've seen more regular ones the size like golf balls and so forth, okay? But that's what that is. It's filled with pus, which is dead bacteria, white blood cells, and a lot of debris, Okay? So this is just showing you different areas of infarcts. Here is one on the liver. All right, and here, I guess it was cut off over here. There's something that's strangulated here, allowing less blood flow going to the rest of the intestines. And all this red area is an infarct. Okay? Again, you don't have to worry about a red infarct. You don't have to worry about coagulative necrosis. Just know it as necrosis, know it as an infarct, and call it a day. I'm cutting out some stuff for you on that. Okay?
Necrosis, sometimes called accidental cell death, can be considered death by cell swelling and bursting. In contrast to apoptosis, necrosis is a messy process that triggers inflammation. Here is a normal cell, a cell in any tissue. The blood supply to this cell has just been cut off by rupture of an atherosclerotic plaque. Watch this cell undergo necrosis. Without a proper supply of oxygen, the mitochondria in this cell cannot produce enough ATP. Since ion pumps in the cell membrane need ATP for fuel, they no longer work effectively, and sodium and water leak into the cell, causing cell swelling. As the process continues, the inside of the cell becomes acidic. Calcium ions leak into the cell and activate enzymes that damage cell membranes. Cell proteins denature. Mitochondria and other organelles swell. In the end, the cell bursts and spills its contents into the surrounding tissue. The rupture of a cell exposes intracellular chemicals that trigger the process of inflammation. Neutrophils arrive by chemotaxis and phagocytize the debris, while contributing to the inflammation by releasing inflammatory cytokines. Necrosis is an inherently messy type of cell death. To deepen your learning, watch necrosis occur again while describing the process out loud in your own words.
All right, gangrenous necrosis. Gangrene, some people just refer to it as. All right? It's not a different kind of necrosis. It's just a more advanced necrosis. Okay? And it occurs when there's a large mass of tissue rather than at a cellular level. If you see a few cells over there, that's not really gangrene. It's when we see it with a naked eye, a big section. Okay? We usually see more of the hands and feet that get affected with this. Most common cause, MCC, most common cause is ischemia hypoxia, which we've been talking about. All right? That's usually superimposed with some sort of infection. Okay? Complications, the problem we have to worry about is that we want it to stay there while it's being treated. We don't want it to go into the bloodstream. If that infection goes into the bloodstream, then that blood is going to go throughout the whole body. We call that sepsis, that person is septic. And if that person's septic, then that's going to go throughout the whole body. If it's something at the toe, now your brain gets infected. Now your heart gets infected. Now your liver gets infected. When someone has sepsis going on, God forbid, let's say your sister or mother, I would go down and go visit her because it's not a good thing that people have sepsis. Right now, it's the 11th killer in America. So if someone's septic, you know, drop your things and say, I got to go visit her, okay? Because chances are they aren't going to survive that, okay? If it's really bad, it's going to the brain and stuff, okay? The treatment is usually going to be amputation. You know, if it's starting at your foot or starting at your finger, we amputate it before it gets into the bloodstream, okay? All right, so there's 3 types of gangrene. You do need to know the 3 types. I guarantee these will be questions on your NCLEX. So let me explain to you, before we get into the types of gangrene, an example of why something might get septic on something that I think people can relate to, okay? Diabetics. Now, I'm not going to go into diabetes for this moment, but just hear me out for this. Diabetics, they have an accumulation of glucose. The glucose is going to build up into their bloodstream, and glucose is very sticky, and it will stick to the walls, the inner walls of the blood vessels. Now, the problem is, when you build up more and more of that stickiness, it's going to eventually block blood flow through there. Does that make sense? Okay? The places that, the blood vessels that are going to get more affected or affected first are going to be what we call microcirculation. The very, very, very small blood vessels, which makes sense, right? Where are these microcirculated blood vessels, or where do they go to? These are blood vessels that give blood supply to the blood vessel walls. This is blood supply that actually goes to nerves. So look what's going to happen here. Here you have microcirculation that is going to get clogged, and now we can't get oxygen to the nerves. So the nerves start dying. And as you know about nerves, if they ever get fixed, you can't make one nerve split into two. They have a very low cell turnover like muscles do. So once you kill a nerve cell, you can't grow it back. So where does this affect first? Usually for diabetics, usually the feet. It's the furthest place from the heart. So how does the patient present when their nerves don't work in their feet? We sometimes refer to it as peripheral neuropathy, right? Neuropathy. Neuro meaning nervous system, apathy meaning disease. So how does that person present with this peripheral neuropathy? What are they going to... What's that? They'll get some of it, but the usual sensation goes first. So, what were you going to say? Yeah, you're going to get numbness, you're going to get tingling, the pins and needles. So what happens in their feet, they don't feel as well. They can feel the floor, they can feel pressure, but if they're barefooted, they can't tell if this is the rug, sandpaper, or a smooth floor. They can't feel texture. Does that make sense? Right? They start losing that feeling. So when they're walking, and I can pick up a lot of diabetics that are at that stage because of the way they walk. They usually have a little pot belly. I'm not being mean. They just can't see their feet. Okay? So because they can't see their feet, they can't see where their foot is with where the floor is. So they usually will stomp a little bit. They usually have slippers because they don't want to go down and tie their shoes, right? Because they have their pot belly, right? That kind of thing. So they usually just put their feet in their slippers. You know what I'm talking about, right? You've seen it in movies, and and if you haven't, be more observant, right? So they're doing that, and they're stomping their feet because they don't know where the floor is, kind of thing. You've seen that, okay? Now the problem is that when they stomp on something, they could stomp on a piece of glass, or a thumbtack, or if the hardwood floor, they get a splinter. Old floors and stuff, but they don't feel the pain. So now they got a bigger problem because now they have that splinter there that's been bleeding. Your skin is supposed to protect you from the outside world in, so bacteria can't get into your bloodstream. Does that make sense? But now you just created with a piece of glass or something like that. You just created a new window and said, "Come on in, bacteria, come in, because we just opened this up." You see, pain is a good thing. You want pain. I know it doesn't sound right, but you want pain. You step on a needle, you're going to say, what the heck is, you take it right out, you see? Or if you have to, if it gets really bad, you have to go to the hospital and have medical professionals do something, right? So pain is a good thing because you get medical help. If it's not yourself, just take the splinter out. But for a diabetic, they don't have that. They don't know if they really stepped on that. So now this splinter or this piece of glass stays there, bacteria starts building over days and weeks, it starts to get infected. And they don't feel that infection. You see it? So if I do this thing, toe, you see it? Yeah, you see it, right? A little wrinkle over here. Okay. So what happens here is, let's say, even if they clip their toenails, see, that's not good either, because they can't tell if they cut it straight or not, right? If they don't cut it straight, you would think that, oh yeah, I'm just going to cut it, but let's say they cut it like this, and they leave a little piece in like this. That sharp nail is going to grow into the skin. That's an ingrown toenail. And now you've got this sharp nail going in there. You just opened up a doorway to allow bacteria to get into the tissue. So a lot of diabetics, if not all of them, once they become a diabetic, a newly diagnosed diabetic, they have a whole list of new doctors they got to go to. The eye doctor, the kidney doctor, the heart doctor, and the podiatrist also. The podiatrist is going to make sure once a month they clip the toenails to make sure that you're not going to have these kind of infections. See? It's good to have a podiatrist. They clip your toenails. They do everything for you with your toes. They'll sand down. Oh, believe me, I've seen my father's toes when I tell you, they look like lizards, dinosaur feet. They get really bad when you get in the 70s and 80s. Just be kind to your feet so they can do that way. But they take care of all this. They shave things down and stuff. They do everything but paint them. I'm sorry. Okay? But they make sure you don't have this. Now look what's going to happen. This goes in there, gets infected. They don't feel pain. Now this whole area over here becomes necrotic. Because the infection, you're not killing it. So now this thing grows. This becomes a big prune. Black. And the infection is going to keep on going. Now keep in mind, you've got a bone in here. You don't want this infection to go inside the bone because you've got bone marrow that is loaded with blood vessels. If that infection goes in where the blood vessels are, you're going to become septic. So when this is all dead over here, the only thing to do is amputate. You got to remove it because you can't do anything with that tissue there. It's dead. It's gone. Forget about it. But you need to make sure it is not going to spread into your bone because it'll become septic. Avascular necrosis? Well, because all your blood vessels are shot here. Yeah, I wouldn't call it avascular, though, because it was blood vessels there to begin with. Yeah. Right, does that make sense? You understand how we... Okay, so let's talk about the 3 different types of gangrene. It's whether it's infected or not. Okay? So keep that in mind. So we could have dry gangrene. Dry gangrene, it's black. All right? Just the way dead tissue appears, it becomes black. It looks mummified. It looks like a prune. But it's not wet. You don't see that gloss on it. That's telling us that, and you don't have to worry about the different types of necrosis, but that's telling us that, yes, the tissue's dead. This is a great opportunity. We need to amputate it because we didn't make sure it doesn't get infected. Okay? So that's what will happen over here. All right? Usually it will just fall off. It's like a scab or something. But if it's really big, you might have to just amputate it. Okay? Then we have wet gangrene. Wet gangrene is basically, it looks the same way, but now it's wet. Okay? And it has this very foul smell to it. This is where you're going to have an infection. And the most common infection you get is Clostridium species. You have to talk about Clostridium with you. That's why I don't want to have microbiology concurrent with you. Does that make sense? Because you should know what Clostridium is. So Clostridium, who ever heard of C. diff? Right. The C is Clostridium. See? C. difficile. Right? But Clostridium species, all right, that will lead to sepsis. It's wet, it's black, it's very foul smelling. Okay? As a nurse, you should pick up the differences between here. You're at a family reunion, and Uncle Bob wants to show you his black toe. I'm like, oh, that's not something we want to see at a family reunion. But if you're a nurse or a nursing student and you see it wet and foul smelling, let's go tonight to go see the doctor. You see what I'm saying? Okay? Then we have gas gangrene. This is the most severe. This is where, again, it's gangrenous. It's due to Clostridium, but it's so bad that the Clostridium is now starting to break down the tissue and producing a gas to it. It's a more severe, more advanced case over here. This we don't usually see as much, but when you move the toe, if it's on the toe, move the toe a little bit, it crackles because you're popping those air bubbles in there. This is immediately bring them to the hospital because once it's diagnosed, they usually have about 2 to 3 days to survive before it gets into the bloodstream. Okay, so you should be able to identify the 3 different types of gangrene. That's pretty critical for you guys to understand, and you as a nurse should be able to pick up the differences there. Not so much about the different types of necrosis, okay, because it's more inside, but you should be able to pick up this. See on a clinical setting, a bedside area. Okay? So questions about that? Okay? And these are just different sites of where you might see gangrene. All right? But here's one due to frostbite. Okay? There's nothing you can do about that. It's gone. So this is the site of where we're going to amputate. You can't do anything about that. Does that make sense? Okay? And that's a pretty severe one. Okay? That's just really off the wall. This is a diabetic that just said, I think I should get it checked. Think? All right. All right? All right, so apoptosis. Again, apoptosis is cell suicide. Okay? It's programmed death without inflammation. Okay? Now, some of this could be a normal thing, though. All right? For example, in embryogenesis, forming the or going from the embryo to the fetus. First off, let's say your hands over here, it starts as one limb bud, and then all of a sudden you're going to see like fingers starting to develop. But as it opens up the hands, there's still tissue in between, a webbing, so to say, in between the fingers. Well, those webbings over there is cells. So there's program inside here saying, okay, after the, I'm just giving you numbers, after the 100th mitotic stage over here, the mitosis, we're going to stop making these cells in the middle here. Does that make sense? They're programmed to stop making it so you don't come out with webs. Now, in certain cases, it can happen. There's certain teratogens that might cause that and stuff. But normal physiology, it should just stop. And there's other examples where we have normal apoptosis happening. Okay?
Apoptosis, often called programmed cell death, can be considered death by cell shrinkage and dismantling. In contrast to necrosis, which is a messy process, apoptosis is a tidy process that does not trigger much inflammation. When a person has a bacterial infection, the number of neutrophils normally increases. After the infection has resolved, the extra neutrophils are no longer needed. This neutrophil is no longer needed. Watch it undergo apoptosis. When internal or external signals trigger apoptosis, enzymes called caspases are activated within the cell. Caspases disassemble the internal components of the neutrophil in an orderly fashion. As the caspases tear apart the cytoskeleton, the cell starts shrinking. The dying cell forms multiple buds that contain portions of its cytoplasm and fragments of the nuclei. Pieces of the cell bud off completely and form membrane-bound apoptotic bodies. Note that each apoptotic body contains a portion of the cell. The apoptotic bodies are surrounded by cell membrane. As the process continues, the entire cell is packaged into multiple apoptotic bodies. Inflammation does not occur because the cell contents do not spill out into the surrounding tissues. The apoptotic bodies are phagocytized by macrophages or by neighboring cells. Apoptosis is an orderly, tidy process of cell death. To learn most effectively, watch apoptosis occur again and describe the process out loud in your own words.
But we also can have pathologies that can induce apoptosis much earlier than what they should happen. If they're supposed to be programmed to do apoptosis at 100th division, but there's certain pathologies say, well, we're going to stop it at 50. Not a good thing either, okay? Cell injuries can do that, infections can do that, and so forth. And the cells will just die there. We also have the opposite, where we could have certain pathologies that actually induce it. It actually, that stops the, make sure that the apoptosis doesn't occur. And those are a good example is cancers, right? Like I said, cancers may, it's not all of them are like this, but it can actually say, well, you're supposed to go to 100, but don't worry. I talked to the big guy up in the brain. Don't worry about it. You go keep on going. Meanwhile, it's an imposter. It's cancer telling them to keep on making more. Does that make sense? All right. So that's one of the reasons that cancer can occur. Why? Well, that's where cancer research is going in. And they have certain medications that could tell that cancer to, or that cell to stop growing. And that's where that comes in. Okay?